Good afternoon. My name is Jimmy Lewis. I'm CEO of Hometown Health, and we're gathered today to share with you the thoughts on the value of rural health through Rural Health Day as celebrated by the National Offices of Rural Health. So the question is, what is National Rural Health Day? Well, National Rural Health Day was started in about 2010 for the purpose of celebrating the many works and partnerships and collaborations that go with the various people who make healthcare in rural Georgia especially beneficial. We have many good partners, we have many good programs, we have many good things that we work together on, but the thing that's most important about what we work together on is the fact that we've got patients in rural Georgia that genuinely do need good quality, cost-effective, high-quality access to healthcare. This day, November the 15th, that we're celebrating for, is all about being able to recognize many efforts that goes into this particular program. In Georgia, we've got 20% of our population is rural. They need high-quality access to healthcare just like anybody in an urban setting needs. So it's just worth our while to stop, take a moment, and think about what it all is that makes this work so much. The thing that makes it work, again, is the collaborations and the commitment from all the parties involved to provide access in many variety of forms. It can be in hospitals, it can be in providers, it can be in community service boards, it can be in federally qualified health centers, it can be in all of those things. But the thing that interestingly makes it kind of work is the fact that we've got a great program, collaboration with our State Office of Rural Health, whereby we share information, we share services, we share standard ideas and thoughts, and then we get together and work on things like the Rural Hospital Stabilization Committee and all that goes with that. So with that said, it's worth noting that, as we say in South Georgia, this ain't an easy task from time to time, and it's not because there are many barriers, there are many obstacles, whether it be reimbursement, or whether it be a shortage of physicians, or whether it be a shortage of people who understand how to file claims and all of the things that go with that. It can be a real problem. In addition to that, we see the needs with our patients as exhibited by the current crisis that we have that's in opioids, and the fact that we have to find ways and means to work with the opioid problem. It's a real challenge, and it's not getting smaller on a daily basis. It's extremely important that we recognize, again, the patient and the needs of the patient and what it's all about. Now, we know that rural healthcare is a challenge, again, because of these shortages, because of the problems that we've had maintaining hospitals. We know that we've had some hospitals to close. We can list all of the reasons that they've closed and the problems and the challenges. And we do that, we need to recognize that there are many successes. And the successes are we've got many hospitals that are still open. We've got many physicians, nurses, nurse practitioners who are providing the access to these patients who otherwise could not get the health care, don't have cars, don't drive, are well past the driving age. Many, many barriers, the barriers of technology that we see. But for as much as we've got those barriers, we still have hundreds of people that show up every day for the sole purpose of ensuring that there's good quality access to that group of patients who indeed do need this kind of care. From a hometown standpoint, we've been committed to it from day one. Our mission is to do whatever we can to make sure that a hospital survives and stays available to provide access to the many patients that we have out in the community and to work with the people that can make this work. We spend a lot of time in the legislature. We are now preparing to go to the legislature for our 2019 session. It's going to be a difficult time having come through the recent elections. A lot of new legislators are elected and have to learn their way around, and we have to learn how to work with them to get their way around. A lot of critical issues, whether it be a reimbursement issue or a certificate of need issue or a big funding issue. All of those things are real challenges for us, but we learn how to work through them, and we do that through grassroots and education and bringing people to the Capitol and let them see how democracy works, and it's just a really good thing. So it's with all that said that we then go to spend time with our State Office of Rural Health. We're real pleased with our State Office of Rural Health. Patsy Whaley is the director there, and she and her team do a grand job. They travel all over the state, They wear out their vehicles trying to get to and from hospitals of need. They provide information. They're great data miners. They do a great job in grants and grant applications. And they just do a good job for us anytime we need them. They're like we are. They're a 7 of 24 group of people, and they just make it happen. So this day, November the 15th of 2019, we'll celebrate as National Rural Health Day, and we'll celebrate it with our Office of Rural Health for the great work that they do, for our team here at Hometown, and then for the collaborators that we work with all over the state of Georgia. So it's with that we want to say thank you for joining us. Thank you for sharing with this message. Thank you for doing what you do, and thank you for allowing we at Hometown to make sure that we do provide you with the services that you need, and we thank you for the support that you give us in doing what we do.